Today we're going to be talking about the HINTS exam. Specifically, we'll talk about how to administer the HINTS exam, who you would want to perform this test on, and how it's helpful in differentiating peripheral versus central cause vertigo. The HINTS exam is composed of 3 separate tests, which include the head impulse test, a nystagmus assessment, and a test of skew. Typically, you want to perform this exam only on patients who present acute but persistent vertigo, as well as observable nystagmus. We talked about how this exam helps you differentiate central versus peripheral causes. A central cause means that the vertigo is being caused by something in the central nervous system. Specifically with the HINTS exam, we are looking for posterior stroke symptoms, whereas peripheral causes means that the vertigo is being caused by structures of the inner ear or the vestibular cochlear nerve. It's important to differentiate between these two causes because, as we know, a stroke is a serious medical condition that requires immediate attention, whereas peripheral causes of vertigo are benign and will sometimes resolve themselves within 7 to 10 days. To start off this exam, it's easiest to perform the nystagmus assessment. Nystagmus is when the eyes move rapidly and involuntarily back and forth. Different types of nystagmus can be broken down based on the direction of eye movement. You can have vertical nystagmus, horizontal nystagmus, or a combination. Nystagmus can further be identified by the direction of the fast-beating component of the eye movement. For example, if the eye beats to the right faster than it moves to the left, you have right-beating nystagmus. On the other hand, if the eye moves faster to the left than to the right, you have left-beating nystagmus. When performing a nystagmus assessment, it's important to have the patient look both to the right and then to the left. If when doing this you notice that the fast-beating movement changes direction, you have bidirectional nystagmus. Bidirectional or purely vertical nystagmus is indicative of a central cause of vertigo, which means that the patient may be suffering from a posterior stroke. Before we take a closer look at nystagmus, it's important to mention that this patient in these videos does not have vertigo, and he does not show any neurosigns. This means that as he tries to exhibit different signs, they may be exaggerated. That being said, let's take a closer look at how nystagmus may present itself. This patient is exhibiting left-beating nystagmus. Because we had the patient look both to the right and to the left and the fast-beating component did not change direction, his nystagmus is purely horizontal and it is purely left-beating, unidirectional. This means that if the patient has vertigo, it is most likely due to a peripheral cause. Now let's move on to the head impulse test. This test takes a closer look at your vestibulo-ocular reflex. This is the reflex that makes it possible for you to maintain steady gaze while moving your head back and forth. If you want to try this out, just read the words head impulse test while moving your head quickly to the right and to the left. You're able to clearly see these words because of your vestibulo-ocular reflex. This reflex is under peripheral control. This means that if during the head impulse test, the patient is not able to maintain a steady gaze, the problem lies with the peripheral structures. However, if the patient is able to maintain a steady gaze throughout the test, this is a more serious finding and indicates that the patient may be suffering from a stroke. Let's take a closer look at the head impulse test. Here you see the patient maintain a steady gaze throughout the test. This can be a more serious finding and indicate a posterior stroke. This is because the vestibular-ocular reflex is still intact and it is under peripheral control, which means that the problem does not lie with the peripheral structures. It's also important to note that in patients that may have a more fragile neck, it can be beneficial to have the head move quickly back to center so that you prevent over-rotation of the neck. Now let's take a look at a different finding from the head impulse test. In this test, we see the patient exhibit a horizontal corrective saccade. This means that the patient's eyes jerked with his head, and he had to rapidly move them back horizontally in order to refixate. When performing this test, you want the patient's head to be as relaxed as possible, and you want the quick jerk to be faster than 60 degrees per second in order to really test the reflex. You can tell the patient to focus on your nose as you are performing this test on the patient. Again, if the patient is able to maintain a steady gaze, this means that the cause of vertigo could be from the central nervous system. However, if the patient exhibits a horizontal corrective saccade, this means that the cause of vertigo is most likely peripheral. The final test of the HINTS exam is the test of Skew. This test is helpful in identifying brainstem or cerebellar involvement, which are both parts of the central nervous system. To perform the test of Skew, you will have the patient again look straight ahead with a stable gaze. You will then cover one of the patient's eyes with your hand. You'll keep it there for a few seconds before moving your hand to the opposite eye. Once you do this, you must observe the eye that was previously covered. If you see vertical or diagonal movement, this means that the cause of vertigo may be central. However, if the patient maintains a steady gaze, that means that the cause of vertigo is most likely peripheral. Let's take a look at the test of Skew. Here the patient is able to maintain a steady gaze. This would mean that his cause of vertigo is most likely peripheral. Let's take a look at a different result from the test of Skew. In this video, you see the patient's eyes move vertically and diagonally. This would be indicative of a central cause of vertigo. Let's review. When performing an nystagmus assessment, you are looking for either vertical or bidirectional nystagmus. This is indicative of a central cause of vertigo and tells you that the patient may be suffering from a posterior stroke. However, if the patient has purely horizontal nystagmus that is unidirectional, then the cause of vertigo is most likely peripheral. Let's review the head impulse test. When performing this test, if the patient is unable to hold a steady gaze and instead exhibits a corrective facade, their likely cause of vertigo is peripheral, as the vestibular ocular reflex is under peripheral control. However, if the patient is able to maintain a fixed gaze throughout this test, this means that their cause of vertigo may be central and they may be having a stroke. Finally, we have the test of Skew. With the test of Skew, you must look for eye movement when you uncover the eye. If you see the eye move vertically or diagonally, this is probably a central cause of vertigo. On the other hand, if the eye stays steady, straight ahead, the cause of vertigo is most likely peripheral.